You are in the middle of a private, intimate moment, and everything seems to be going perfectly until that one specific thought enters your mind. Is this going to last? The second you ask yourself that question, you feel the physical sensation of your erection beginning to vanish the moment you start to think about it. It is a terrifying, isolating feeling that makes you feel like a stranger in your own body. What you are experiencing in that moment isn't a failure of your plumbing or a lack of attraction to your partner. It is a predictable neurological shift where your brain's internal alarm system overrides your body's natural arousal. Today, I am going to explain exactly why this happens and give you a specific mental tool that I use every day to help men like you reclaim their confidence. I am Mark Goldberg, a licensed sex therapist and founder of EIQ Men. I specialize in treating psychogenic erectile dysfunction, a condition where the barrier to performance is not a medical issue, but a breakdown in the communication between the brain and the nervous system. I've spent my career helping men move from a state of panic to a state of reliable, sustainable sexual health. There is a massive gap between where you are right now and where you want to be. Right now, you are stuck in a cycle of self-monitoring, where you act as both the performer and the judge. Your goal is to reach a place of embodied presence, where sex is something you experience rather than something you manage. To get there, we have to understand the mechanism that is currently standing in your way. In clinical terms, we call this phenomenon spectatoring. Imagine you are on a stage, performing a play, but instead of being in character, you are sitting in the front row of the audience, watching yourself and taking notes on every mistake that you make. When you are spectatoring, you are no longer a participant in the sexual experience. You have become an observer. Why does this kill an erection so quickly? It comes down to how your nervous system is wired. To get and maintain an erection, your body must stay in the parasympathetic nervous system. This is often called the rest and digest state. It is the only state where blood flow is directed toward the center of the body and the sexual organs. The moment you start to think, is it soft, or does she notice, your brain shifts gears. It stops seeing the moment as a source of pleasure and starts seeing it as a source of potential failure. Failure is a threat, and when your brain perceives a threat, it activates the sympathetic nervous system, better known as your fight or flight. When fight or flight kicks in, your body does something very efficient but very frustrating. It pulls blood away from non-essential systems like your reproductive organs, and it sends that blood to your heart and your limbs so you can theoretically run away from that danger. You cannot be in fight or flight and be aroused at the same time. The two states are biologically incompatible. So you might be wondering, why can't I just force myself to stop thinking? This is the trap that most men fall into. They try to use willpower to fix the problem in the middle of the act. They tell themselves to stay focused or try to breathe through the panic, but the more you try to control the outcome, the more you reinforce the idea that there is a problem to be solved. That only increases the sympathetic nervous system activity. Think about it this way. If I tell you right now not to think about a blue elephant, the only thing you can see in your mind is a blue elephant. If you tell yourself, don't lose your erection, your brain is now hyper-focused on the possibility of losing it. You are feeding the very monster you are trying to outrun. This is why trying harder actually makes the condition worse. A common question I get is it possible for my erections to vanish even if I'm not feeling particularly anxious or stressed? The answer is yes, and this is a key part of how the brain works. Sometimes the threat isn't a conscious fear. It is a subconscious pattern. Your brain has learned to associate intimacy with high-pressure performance. Even if you feel calm on the surface, your nervous system is scanning for signs of failure. This is why men often report that their erections are fine during masturbation but vanish the moment a partner is involved. In private, there is no one to observe you, so the spectatoring reflex stays dormant. The presence of another person adds the element of judgment, which triggers the internal observer. To break this cycle, we have to move away from outcome-based sex. Most men are taught that the goal of sex is the erection and the climax. When that is the only metric for success, every dip in arousal feels like a total failure. This creates a binary state of winning or losing, which is the perfect breeding ground for spectatoring. Instead, we focus on sensory-based sex. This means shifting your focus from the result to the actual physical sensations happening in your skin, your hands, and your breath. When you are deeply connected to sensation, there is less room in your brain for the observer to take over. You're moving your head back into your body. However, simply knowing this isn't enough to fix it. You need to understand your specific why. Every man's nervous system has different triggers and different ways of processing performance pressure. Some men are triggered by the transition from foreplay to intercourse. Others are triggered by the moment a partner makes a specific comment or even a facial expression. If you find yourself constantly confused by why your body isn't responding, even when you want it to, you are likely missing the data points that explain your unique situation. Most men treat ED like a mystery or a curse, but it is actually a physiological and psychological puzzle that can be solved with the right diagnostic tools. If you are at that point that you are tired of guessing and you want an objective clinical picture of what is happening in your nervous system, I want to point you toward a specific resource. I've developed a comprehensive diagnostic course designed for men who are serious about improving erections. This isn't a simple internet quiz. It is a clinical-grade instrument that analyzes hundreds of data points across your history, your symptoms, and your psychological triggers. It is the same process I use with my private clients to determine exactly where the breakdown is occurring. If you want to stop the guesswork and get a clear roadmap for how to move forward, click the link in the description to look at the diagnostic course. It is the first step in moving from confusion to a structured recovery protocol. Now, I promise you a tool that you can use when you feel that vanishing sensation start to happen. It is called the 5-4-3-2-1 grounding technique, but adapted specifically for the bedroom. The moment you feel yourself starting to spectator or look at yourself from the outside, I want you to mentally name 5 things you can feel physically right now. Maybe it's the weight of your body on the bed, the temperature of the air, the texture of your partner's skin, or the feeling of your own breath. By forcing your brain to identify specific sensory inputs, you are essentially clogging the negative signal. You are giving the brain so much sensory data to process that it doesn't have the bandwidth to maintain the observer role. This technique works because it pulls you out of the future, where you are worrying about what might happen, and it pulls you back into the present moment. Remember, your body cannot be anxious about the future and fully present in the current sensation at the same time. You are choosing to prioritize the now over the what if. It is also important to realize that recovery is not a straight line. You might use this tool and find it works perfectly one night, and then the next night, the spectatoring returns. This does not mean you are back at square one. It means that your nervous system is still learning that it is safe. Every time you successfully ground yourself, you are laying down a new neural pathway. The goal isn't to never have a stray thought again. That is impossible. The goal is to notice the thought, acknowledge that it is just your nervous system trying to protect you, and then gently steer your focus back to the physical sensation. You are training yourself to be the pilot of your attention rather than a passenger to your anxiety. As you move forward, try to be patient with the process. You didn't develop this pattern overnight, and it will take some time to unlearn the reflex of self-monitoring. But the more you understand the why behind the vanishing erection, the less power the experience has over you. When you understand the mechanism, the fear starts to dissolve. And when the fear dissolves, the erections return. You deserve a sex life that feels like an expression of pleasure rather than a test you have to pass. By moving from your head into your body, you are reclaiming your right to be present, to be connected, and to be whole. Keep focusing on the sensation, keep grounding yourself in the present, and remember that your body already knows how to do this. You just have to get out of its way.